bringing you the latest health news and medical breakthroughs. This is KMAX Medical Minute.
All right, March is Colon Cancer Awareness Month, and this happens to be our medical expert, Dr. Samir Islam's specialty. Joins us now to tell us a bit more colon cancer. So important to get screened for this too, and a lot of people say, I don't want to do that because the thought of it can be scary. Is it really that scary though?
So the procedure itself is not scary. So getting a colonoscopy is probably the best way to screen for colon cancer. What I tell my patients is that it is probably the best test you can do to prevent this cancer from happening. It is an easy test. Now, I know people have some, or have heard some horror stories about it, but it really is probably the best test we can do to prevent a cancer that is completely preventable.
Okay, so talk a little bit about how preventable is it if it is caught early?
Oh, it is 100% preventable.
Okay.
If we can find the polyp, which is a precancerous growth that has the potential to go into cancer, by doing a colonoscopy, we can remove that polyp and virtually eliminate your risk of developing cancer. There's almost no cancers we can eliminate like we can with colon cancer.
Wow, that's fascinating. Okay, so what are some of the symptoms that we see with colon cancer?
So sometimes it can be bleeding, change in bowel habits, abdominal pain, but the scariest symptom is no symptoms. And this is why we recommend everyone starting at the age of 45 at the latest to at least get one colonoscopy, because you never know what is growing inside that colon.
Okay, you mentioned 45. We kind of heard about an increase in younger adults as well. So 45 you think is the youngest, or do you think maybe when you turn 40 you should start doing it too?
It's a good question. Well, right now 45 is the latest we would wait.
Okay.
Now that may change if you have a family history or if you have symptoms. You may want to consider doing it earlier, but no later for sure than the age of 45.
Okay, are there any new treatments or screening options for patients right now?
Absolutely. So not everyone wants to get a colonoscopy, which is understandable. So there are other tests that are out there, whether it's stool testing or blood testing, that are out there that are covered by insurance. So if you don't want to do a colonoscopy, that's okay. You can do other testing to make sure we can find precancerous polyps and prevent colon cancer.
Okay, and so what are certain things that people can do that may predispose someone to this disease?
So we know that knowing your family history is probably the biggest risk factor. So know what your family history is, but diet. Diet plays a role. So the foods that we eat can affect how the risk is for developing colon cancer. So high fiber diets, low fat are the best things you can do to prevent that risk.
Okay, and don't worry about the prep.
Yes.
Even though that's in your head, do not worry about the prep, right?
Do not worry about it. It is easy, it is simple, it is a lot easier than maybe you've heard in the past or your friends may have heard about.
And the benefits definitely outweigh it too.